close your eyes. Picture, if you will, a hypodermic needle. The plunger, the barrel, the needle, the tip. Can you see it? Now, picture 8 Olympic-sized swimming pools overflowing with them. That is how many needles have been removed in the United States from household trash, our parks, playgrounds, beaches, and our streets by free needle exchange programs. Today, I'm going to inform you about the current heroin epidemic and how one local organization is addressing the problem. There are three main points I'd like to touch on. The first, what is heroin and why such an increase in usage? The second, what are the dangers associated with heroin usage? And finally, third, I will speak about the Hamilton County Heroin Coalition and their efforts to address the local heroin epidemic, including providing clean needles and disposing of dirty needles through their free needle exchange program. So what is heroin? According to the National Institute on Drug Abuse, it is an opiate derived from the poppy plant or synthetic substitutes. It halts pain, it causes a euphoric feeling, it enters the brain very quickly, and that makes it an extremely addictive drug. There are over 4.8 million Americans over the age of 11 that have already tried heroin at least once in their lifetime. Even more alarming is there's no one face to the heroin addict. It is not the junkie in the dark alley shooting up. According to Lieutenant Joe Wiseman on the Dayton Police Narcotics Bureau, it is across the spectrum, from the wealthy to the low socioeconomic areas, races, sex. It covers all boundaries. Mom, dad, junior, teacher, nurse. Those are the new faces of the heroin addict. So what's going on? Why has there been such change, and why so many using this drug? Several factors are at play here. The first, according to the Substance Abuse and Mental Health Services National Administration, the use of controlled substances is at an all-time high, with some 6.8 million Americans abusing prescription pills. This raging pill epidemic has caused a clampdown on pill mills. That clampdown has made pills such as Percocet, Vicodin, and OxyContin harder to get and more expensive on the black market. This has created an atmosphere ripe for addicts to make the switch over to heroin, which is far cheaper, in fact 1/10 the price, and much easier to find. It's simple economics, really. This may be news to you, but it's likely not to a neighbor, a friend, or even a family member. So now that we know what heroin is and why more people are using it, let's look at some of the dangers associated with heroin use. First, I'd like to talk about the spread of infectious diseases among users such as HIV and hepatitis C. Basically, if you share needles, there are severe consequences. The statistics are actually shocking. 70 to 80% of intravenous drug users will contract hepatitis C and 10 to 20% HIV. This equates to 3,000 to 5,000 transmissions of HIV each year and over 10,000 hepatitis C transmissions from using infected needles. You might notice that the hepatitis C transmission rate is much higher than the HIV rate, and you might wonder why. Well, hepatitis is actually a much more resilient virus and can actually live outside the body for several years and is far more potent than HIV. HIV, 90% of its infectious kick is gone within an hour of leaving the body. And what about some of the costs involved? Approximately 30% of HIV patients are uninsured. That's 1.7 million Americans that are either not being treated and potentially spreading their disease, or being treated under a federally funded program. Programs such as Medicare and Medicaid. The federal budget request for the fiscal year 2015 actually includes a total of $30.4 billion for domestic HIV and AIDS spending. That's a lot of taxpayer money being spent. And then there's the exposure to non-users, groups such as police officers, sanitation workers, and the general public at large. For the police, according to the American Journal of Preventive Medicine, 30% are stuck at least once in their lifetime, 25% twice or more. And when that happens, the repeated testing that they have to go through over at least a 12-month period is a very costly expense. Additionally, locally we have had children accidentally pricking themselves, and that has caused great health scares. So there's a need for needle exchange programs. What are they? That's what we'll look at next, and how they came to be. Between 1991 and 1997, the United States government funded 7 reports on clean needle programs for people who inject drugs. Unanimous in their conclusions, clean needle programs reduce the transmission of infectious diseases. And none found that clean needle programs caused rates of drug use to increase. The following year, in 1998, Donna Shalala, then Secretary of Health and Human Services in the Clinton administration, stated, "A meticulous scientific review has now proven that NEPs can reduce the transmission of diseases and saves lives without losing ground in the battle against illegal drugs." Some additional services offered by NEPs: education of risk reduction, the referral to drug treatment centers, and job and other social services. Basically, they provide an opportunity to reach the populations that are often difficult to engage in treatment. So, NEPs serve as a safe, effective method for intravenous drug users to exchange used syringes and sterile needles. Since the 80s, they have resulted in reductions of up to 80% of HIV incidence. As you can see, access to sterile needles and syringes is important, even vital, to reducing the transmission of infectious diseases. So who makes up the Hamilton County Heroin Coalition, HCHC? And what are they doing? The group consists of law enforcement, fire departments, emergency medical, and several other organizations. They provide a platform for collaboration between numerous agencies working on addressing this heroin epidemic. This coalition utilizes best practices, unites and focuses resources, supports legislative change, and provides education to increase public awareness. They address several specific areas within Hamilton County and the surrounding area. Someone dies every day of a drug overdose in Hamilton County. The hepatitis C infection rates among young people have more than doubled in the past 5 years in Hamilton County. And 36% of new HIV infections are attributed to injection drug use in Hamilton County. According to Adam Riley, an HIV educator who volunteers with the coalition, heroin and discarded needles are a real problem that's spreading. So HCHC's Needle Exchange Program now allows drug users to seek help and exchange their used needles for clean ones. It's the first free needle exchange in the area. But not everyone agrees that this is a best practice. Those opposed, such as the Citizens for Community Values, a conservative group based in Sharonville, say that NEPs enable drug users instead of addressing the core issue. They believe that NEPs send mixed messages to our youth and don't reduce addiction rates. Supporters counter that programs not only reduce disease, but provide more opportunities to connect drug users with other services to help them beat their addictions. It accomplishes so many goals at once. It reduces the burden to taxpayers for hospital visits from overdose cases. It helps prevent first responders from getting stuck by needles. It can reduce crime, and it can get some of the users into treatment programs. Dr. Judith Feinberg, Project Medical Director and UC Professor of Medicine, states, "The Hamilton County Heroin Coalition's efforts are to be commended. We are losing a person every single day due to heroin. So they are addressing a very big problem in our community." So we now have in the forefront of our minds what heroin is, who the users are, and what has contributed to the substantial increase in usage. We also have a better understanding of some of the major damages caused by heroin use. Finally, we are now familiar with needle exchange programs and how the HCHC is implementing its practices, thereby addressing the local heroin epidemic. After hearing all the information I have shared, if you are at all tempted to think this problem doesn't really concern me, I ask that you think about this. What if your child was running through a park, playing on a beach, romping around the playground, or simply walking down the street, when suddenly they feel a sharp prick, lift their little foot, and see a needle dangling from the bottom of their flip-flop? They remove the shoe and the needle with it, and see a small spot of blood right where the dirty needle punctured their foot. Would you still be thinking it doesn't concern me? I bet not. Remember the 8 Olympic-sized swimming pools that I referred to in my opening? That's 45 million additional risks that we are exposed to without clean needle exchange programs. Thank you.